Hi everyone, Jillian Parker back again to continue our discussion on COVID-19 and the flu, and Tatiana Timkiff is joining me again today, the Executive Director of Employee Health Services and the Wellness Department, to talk about some of the symptoms of COVID-19 and the flu, some of the differences between them, how we can tell the difference. So Tatiana, my first question to you is, what are the common symptoms of COVID-19 and flu?
Thank you. I like the question because probably many people have this question too. So COVID-19 and flu share few common symptoms that would include fever and or feel feverish, chills, tiredness, headache, cough, running or stuffy nose. Some people can also develop vomiting and diarrhea, but usually you see those symptoms more in children. Those are the common symptoms that both flu and COVID-19 would cause.
So if someone's feeling sick at home, then are there any differences that stand out that people can be on the lookout for?
Very difficult to separate or differentiate those two diseases. And the only difference in symptoms that COVID-19 can cause, it's a loss of smell or taste. Mm-hmm. But when someone is experiencing flu-like symptoms, they have to keep in mind that they can also have COVID. Therefore, it's very important for them to contact their healthcare provider because they might need to get tested for COVID-19.
A big question, I think, is can you have both at the same time?
Definitely, you can have both at the same time. That's what experts are saying, and it would be challenging for those people that have underlying health conditions if they have both flu and COVID-19. Therefore, we need to call our healthcare provider, and healthcare provider will make a decision what test will be ordered. They might order both tests to test you for flu and COVID-19.
So depending on the symptoms you might be experiencing, your healthcare provider will make that decision whether you need a test for one or you should be tested for both.
I agree. Yes, healthcare provider should make this decision.
So if people aren't feeling well, I think I know the answer to this, pending what I just asked you, but if people aren't feeling well, what is the next step to do?
Thank you. Of course, if you're not feeling well, first thing what you have to do is to stay home. Do not go to work and isolate yourself. Most people will develop mild symptoms and can recover at home without medical care. But if you feel that you are sick, in most cases, you should stay home and avoid contact with other people, mm-hmm. even animals in your house, to keep them from getting some infection.
If you test positive for the flu but negative for COVID-19, is there any thought as to still having to follow any of the same guidelines as COVID-19 as far as quarantining or any of that?
If you definitely been tested only for flu, first thing, I believe that your healthcare provider will guide you for how long you have to be at home. But in general, if you are fever-free for 24 hours without any medications that would reduce your fever, if you feel that your symptoms are overall improving, and if this is only flu that you've been tested, again, I'm repeating myself because this is very important to understand.
Yeah.
If you was negative for COVID, then your isolation period may be shortened than isolation period for COVID.
And I feel like there's a common denominator here, which is contact your healthcare provider if you are feeling unwell. Even if some of the symptoms seem minor at the time, how important is it that people are still calling their healthcare provider, at least for a telemedicine visit, to make sure that it's not something they're concerned about?
Absolutely. I also would suggest that they should keep track of their symptoms. But it's important to mention during this conversation that if you start developing some warning signs of emergency mm-hmm. symptoms, such as shortness of breath, difficulties with breathing, being overly fatigued, having difficult time waking up or staying awake, if you start noticing that your lips are turning bluish or you having chest tightness or chest pain, that you need to go immediately to emergency room.
Okay. Tatiana, thank you so much for breaking down some of the similarities and differences between COVID-19 and the flu. And everyone, remember to stay up to date with everything on our Rochester Regional Health website and our social media channels. We will continue to have the latest information there, and we will have more videos coming in the future to keep you informed on everything COVID-19 and flu.